Greetings, Sipan, Nazaryan, and I will be speaking to you about the Guardians of Wellness, strengthening mental health services for healthcare providers, and our disclosures, that I am the CEO of Avedian Marriage and Family Therapy Corporation, including Anger Management 818 and Avedian Counseling Center. And Sipan Nazaryan is an associate marriage and family therapist at our center. No other disclosures to include for today's talk. Some of the objectives for today's presentation is to examine the utilization and reluctance to use mental health services among healthcare providers, to raise awareness among healthcare providers about the importance of mental health services, to reduce the stigma as it relates to seeking mental health support, and to review assessment methods for anxiety, depression, domestic violence, substance abuse, and anger. And lastly, to implement self-care strategies to manage mental health and well-being. To start, I wanted to briefly share about several folks that I had worked with, so some case studies, just to share with you the importance of seeking mental health services when there is a need, and how it can help improve the outcome of well-being. So our first person here, Eric, is an anesthesiologist who has a reputation of becoming easily frustrated when his expectations are not met. He doesn't think he has a problem with anger, but his staff oftentimes report that he yells and puts them down verbally. Some of you may think that kind of sound familiar, whether it's about yourself or someone else that you're working with. It's not that uncommon. Second, Nicole is an OBGYN, and she struggled returning to work from the trauma she endured when she realized her patient's baby had passed away within an hour following delivery. And she was depressed for several months, literally not being able to get out of bed for most of those days and not being able to return to work. And at the end of today's talk, I'll give you guys the outcome of all three of what happened. But again, it's to shed the light of the importance of taking care of ourselves, especially when we're not doing the best we can in terms of our mental health. Lastly, Mark, a nurse, was informed that even though he was an educational nurse, he had to help with administering the vaccine. So he wasn't in practice with doing the clinical work for some time, for several years. And he was concerned with getting COVID because they had asked him, and they had asked all the nurses to start administering the vaccine, and that was a big scare for him. And he didn't want his colleagues to know that he was afraid and uncomfortable and not feeling confident in administering vaccines at that point. So there was a lot of fear as it relates to this. So again, these are just three very different types of scenarios that we see on a daily basis. And we'll talk about some of what the risks are when providers do need mental health needs, but they ignore them. Meaning, I may be feeling depressed, but perhaps I'm going to hold off on seeking therapy, and then the dangers around that. So these are some of the items that we start seeing occurring. One, burnout. I know you guys hear about burnout a lot, but I can't stress the importance of being aware of when you are when you have too much on your plate, when you are not able to handle it, when you need someone to talk to. So here we know that burnout does lead to decreasing job satisfaction. And we also see that there's this risk of leaving the profession. And we have seen this, especially during the pandemic, of a lot of medical professionals not being able to handle the stressors, and then burnout occurred, and therefore they have left the profession. We also risk decreasing quality of patient care. I know this is not news for you guys. There is stress, there's burnout, there's emotional exhaustion. And what we start seeing is that the clinical judgment can be impaired and the quality of care then is reduced. There are increased risk of medical errors. right? So if we're not able to concentrate properly, or our memory gets a little bit impacted from all the stress, and or decision making, we're not as confident in what we need to be doing, then we start risking medical errors. Now, it's not just at the workplace. Think about your own familial relations, romantic relationships, friendships. So many different relationships also get impacted because we notice then if some of the risks of not seeking mental health services when there's a need is that we start becoming more irritable. That's a very common symptom we'll start noticing. Withdrawn, as well as emotionally distant. So you can see how this begins to impair our relationships. Substance abuse, we can turn to alcohol and or drugs, especially where we are under high levels of stress. And of course, when this becomes an addiction or a problem, meaning it's interfering, not only, but it can interfere with the work, then we also see that a lot of medical providers are then needing to go through a diversion program for those needs. There's also an increased risk of suicide. Unfortunately, this is a really large statistic among healthcare providers, and I know Sipan will speak more about that in a bit. There's decreased empathy and compassion. And you know what? That is such an essential for our healthcare delivery. Speaking to patients, we want to make sure that we're at our best, we're grounded, we're content, we feel good, and that we can actually offer empathy so that we create that safe environment for them and they would feel safer. Stigmatization. So, this is a big topic actually in what we're talking about today, because if I, as a therapist, let's say I need some help and I don't want to go to a therapist because I worry that there's stigma related to it. What if people find out? What if people think I'm crazy? These are some of the fears that come up, right? That I can't handle issues on my own. So what I start to model then is that, oh yeah, guys, there is a stigma. We really should keep this hush hush or don't approach it. And so this is the risk that we're also taking, is we could be modeling that for our coworkers, our colleagues, that if you're not doing well, or if you need support, it's okay to go see a therapist or a psychiatrist and get the support necessary. Now, burnout defined. Again, I know, especially with AMS, there's been a lot of talks on burnout, and I'm so glad that that's a big part of what has been discussed in the last several years. Burnout is characterized by emotional exhaustion, cynicism, and feelings of being ineffective. And in 2019, WHO described burnout in the 11th revision of the International Classification of Diseases as a syndrome, not an illness or health condition, resulting from workplace stress that has not been successfully managed. So I think that's really important to note, because again, we want to remove that stigma, and we want to become aware of what burnout is really, when we are approaching burnout, and so that we can do something at the earlier stages rather than be reactive to it when it's too late. All right, so now that we talked about the risks, let's talk about the benefits of taking care of our mental health. And of course, I am a therapist. I'm a big proponent of therapy itself, and I believe in it. But we do see this. There's improved patient care. So when you start seeing a therapist, especially when you're in need of one, you are more likely to make sound clinical decisions. You're able to exhibit empathy and maintain better communication. And it also enhances job satisfaction. So here we start seeing a reduction of burnout. Managing your stress. So obviously you guys are in this very demanding profession. And so it becomes essential for you to know how to cope and manage your stress, which then will reduce the risk of emotional exhaustion. So again, we want to protect ourselves, do our best, and go from there. Personal well-being. So we also will see improved personal relationships. This is even with your home life, right? So if we're doing better, we're better to our family, our children, our parents, our relationships, and we'll start seeing a better sense of overall happiness. There's better self-care. We're more willing to take care of ourselves. Number 5, resilience. We enhance resilience in the face of challenging situations. We'll then cope better with the pressures and uncertainties with the field. And in the medical field, we know that there's a lot of this that comes our way. And reduce stigma. So modeling for colleagues that, hey, I'm seeing this therapist, I'm loving it, I'm growing, I've gained some insight, or I've learned how to manage my stress, or help build my strengthen my decision-making skills, or trust myself more. So what then starts to happen is we're modeling that for others, and others are getting the care they need. And overall, we start seeing this more improved positive well-being of the staff, and it works out well. There are more benefits, by the way. I'm just kind of reviewing some of the main ones here.
I'm going to talk a little bit about depression and suicide amongst healthcare providers. Unfortunately, physicians have the highest suicide rate of any profession. This stark reality points to an endemic issue within the fabric of our healthcare system. Female physicians, as reported by the CDC, are at an even greater risk, with rates significantly higher than their male colleagues. During medical residency, specifically a critical phase, obviously in every doctor's career, the prevalence of depression soars to 29%. The Association of American Medical Colleagues attributes this to a culture where vulnerability is often equated with weakness, and there are a lot of sort of mental barriers to seeking help, unfortunately. Moreover, the suicide risk for medical students is threefold higher than that of their peers.
So
These
high.
num
Yeah.
yeah, these numbers are not just statistics, right? They're an urgent call for cultural shifts that destigmatizes mental health struggles and fosters a supportive environment for our medical professions. Here we have some statistics about the prevalence amongst physicians when it comes to mental health issues. So rates of generalized anxiety disorder, what therapists call GAD, is as high as 24% amongst physicians, which is quite a lot. And rates of PTSD ranges between 4% and 16%. Now, healthcare providers seeking support. A mere 13% to 36% of physicians with mental health issues actually go on and seek therapy. With 40% of physicians reluctant to get mental health treatment, there's a clear barrier we need to address. Nearly half of our nurses feel emotionally unsupported, and more than 1 in 5 healthcare workers suffer from conditions like depression or PTSD. It's clear that there's a need for better support systems and reduce stigma around mental health care in the healthcare industry. Action is needed to ensure that those who care for us can care for themselves.
All right. Let's talk about the reluctance to seek support. And I know we'll be meeting in Vegas, and I'm probably going to ask you guys this question, but what does hold you back from seeking mental health support? So let's talk about what's out there statistically. We see that stigma as it relates to renewal for medical licensure. And I think this may vary state to state with what's going on with the way they're asking questions for the renewals, but there is concern from some around this. So a 2017 study in Mayo Clinic, they found that physicians in a state where initial or renewal application probes about mental health were 20% less likely to seek help. So if they know that they're going to be asked the question if they're seeking mental health services, they're less inclined to seek it because they don't want to answer yes to that. AMA adopted a new policy to word the disclosures differently to only request if the mental health condition is impacting their ability to work. And I think this is so important that they did that, only because it's just really more fair. And we don't want to we don't want to set it up where we're failing the system, right? And if medical professionals do get treated, they may use cash to avoid paper trail. I can't tell you how many of my clients who come in who are in the medical field, dentists, pharmacists, physicians, and a few have actually asked me if I can create a hard copy file for them and not even have an electronic copy file for them. So put that aside, they rather paying cash rather than check or credit card to not have any paper trail that they're coming to see me. And we'll accommodate, because we understand the fears out there that may be associated with something like that. And then during the renewal process, if they check yes to have you ever been diagnosed with, treated for, currently have, then they may need to be required to get all of the mental health information to the licensing board. So if I had to do that, I probably would be worried about seeing a therapist as well. So again, I'm happy to see that the boards are trying to edit the questioning on this so that we can encourage everyone to seek therapy or mental health services. The other reluctance, the reasons is, it's not uncommon for physicians who are ready to cope alone around this. They don't want to look weak. If they're seeing a therapist, that means they need help. I think my understanding is even seeking medical attention is sometimes not practiced as much as non-medical providers are. So I think that speaks volumes of what we need to be doing to take care of ourselves. And then the survival mentality has been programmed from residency. And that is, it doesn't matter if you're losing sleep, you got to do this work extra hours. There are all these requirements, and everyone wants to get through and complete their residency to move on and to becoming the professional. Imposter syndrome, I think this can be as high as 70%, if I'm not mistaken, but imposter syndrome is real. And it's what if people realize I don't know what I'm talking about, or I don't know what I'm doing? And then what may happen is if I am questioning myself, and if that's my fear, I may not consult. I may not check in with another therapist to see, hey, how would you approach if you had someone coming in with these symptoms, right? So I think that becomes very important to be able to check with others. So what keeps you from seeking mental health support? Now, the secret code, please remember this, the secret code to this talk is therapist. Okay, so the secret code to this talk is therapist. But again, I want you to think about what actually keeps you from seeking mental health support. And if you're someone who does already, bravo, hats off to you. You're way ahead of the game. Okay, let's get into the history with Sipan.
I'm sure we all have a bunch of stories as to, 100-hour weeks during our residency program. But I wonder whether people ask themselves about why it is the way it is. So a little bit of the history behind the residency program. So William Stewart Halstead, the father of modern residency system, revolutionized medical training at Johns Hopkins. His work laid out the foundation for the structure of today's residency program. His approach replaced informal apprenticeships with a structured hierarchical system. This model ensured that the junior residents gained hands-on experience while under the guidance of senior residents, learning progressively complex skills as they advanced. While Halstead was a trailblazer in surgical training, it's important to acknowledge that his personal life was marred by struggles with addiction, reminding us that even the most accomplished individuals can face such challenges. Halstead's legacy is a testament to the importance of structured medical education and the human aspects behind medical professionalism. Let's honor his legacy by continuing to evolve medical training while supporting the well-being of the trainees. All right, so we're going to go over a quick pros and cons list of, I guess, the 100-hour model, we'll call it. So to kind of steel man the current status quo, we have to keep in mind that, although it's very rough, I guess, on medical professionals, sorry, it does allow for an environment that fosters really, I guess, it allows for developing a high level of resilience. So long hours help build that resilience and foster an environment where you need stress management skills. You need doctors that are equipped to be able to handle really high pressure decision making situations. But it's also important to take into account continuity of care. So patients benefit from having a consistent team of doctors who are familiar with their medical history and can provide ongoing treatment. So long hours allow residents to follow patients throughout their hospital stay, ensuring comprehensive and coordinated care. Of course, the strawman argument, the cons, on the other hand, are that this is it's very difficult, and it does lead to burnout, and we'll talk about this. So due to exhaustion, residents can make mistakes or deliver subpar care, right? And obviously, we don't want any of that. And of course, this is really difficult on work-life balance. It can be very difficult for clinicians to maintain healthy relationships, hobbies, and to feel like they have a balanced life.
All right. And, we're taking a look at physical health and mental health. You wouldn't expect yourself to go on a hike if you sprained your ankle, right? So we want to make sure we stop and take a look at ourselves, gauge where we're at, and do what we can to take care of us. Evidence suggests quality and safety are negatively impacted when physicians are not well. And surgeons who burn out are twice as likely to commit a medical error, twice as likely to be liable for medical malpractice with a litigation suit. And nurse burnout is correlated with hospital-associated infection. And burnout impacts lower job performance. And it's related to healthcare workers leaving their careers. And even ask yourselves if you have ever felt burnt out doing what you're doing. Did you ever start considering leaving the profession, changing your career because this was too much? Also, physicians are twice as likely to leave their current jobs when there is a high burnout. So again, check in with yourselves because you know who you are, and if you're ignoring things for yourself, at what point would you think this is a good time for me to seek support? Now, we also want to take a look at the medical system. I'm speaking more about you as an individual, as a provider, but we know our setup isn't to par yet. Our setup has been more reactive versus proactive. I worked as an employee assistance program and a physician's assistant program, and I know hospitals have that in place to offer support for physicians and the medical field. But it's not necessarily always utilized as much as one would like, or additional services are not utilized as much as it would be helpful. So let's see here. So burnout occurs when there's an imbalance of job resources and job demands. Most current approaches rely on the individual. So that's you. It literally relies on you speaking up that you can't handle this, or this is too much for you, or you need a break. And unfortunately, there's this mentality in the medical field of just keep doing it. My colleagues are doing it. I should be able to handle this, right? And I know some of you work really, really late, like you're on call. You don't really have enough breaks for yourself sometimes. There's little research on the solutions. And again, I mentioned that there is that some of the issues do lie in with the system and what's expected. And that we do also note that physicians do struggle to identify when they're in need for healthcare. So let's take a look at some of the contributing stressors for healthcare workers. So there are irregular shifts and long working hours. This is not news for you guys, but this was what was fascinating, is that there's a new study found that if national recommended guidelines were followed for care, this blew my mind when I saw this research, 26.7 hours per day is what would be needed to see an average number of patients per day. So we get to see how much is really expected of providers, the medical field. So here at preventive care was calculated at 14.1 hours a day. Chronic disease care was calculated at 7.2 hours a day. Acute care was 2.2 hours a day. And documentation and inbox management, which we've known in the last 20 years have increased drastically, but that's at 3.2 hours a day. There's time constraints. There's intense emotional and physical work involved. Of course, you guys are dealing with human suffering and potential death. And there's also exposure to illness and violence. I know when I worked in the hospital setting, there was 1 year that the violence doubled in the hospital setting. So and I think that was national throughout nationwide. A lot of the hospitals were experiencing a similar increase in violence. So So there's that you guys are dealing with. And then the expectations and pressures from patients and family members, as well as colleagues in the workplace. So we know family members can be very demanding on healthcare providers to make sure that their loved ones are being well taken care of, but then that just keeps adding the stress to the provider, and perhaps it may impact the provider's interest or ability to do the best they can. Here I wrote the statistics. 79% of physicians reported burnout before the pandemic. So I know there was a lot that came forward during the pandemic about burnout, but this has been an issue way before the pandemic. The pandemic just exacerbated this whole concept of burnout. So what are some considerations? You heard me bring up this a little bit before, which is prevention, primary prevention. We want to be proactive. And we want to be able to identify the risk factors and to eliminate them. So there were efforts made by NIOSH to improve mental health. NIOSH is the National Institute for Occupational Safety and Health, and they offer several goals to improve mental health in healthcare workers. And some of the resources are to help raise awareness regarding mental health, such as suicide awareness. You already heard the statistics that Sipan shared earlier. So we see that there's definitely a concern there, and we need to get more support out there for physicians and medical care workers. And we also see substance use disorders, right? There's a lot of use, there's access to medication, and they are stating to increase access to care. So not everyone in the medical field are able to afford the services. You know, there's also medical loans. One other thing I wanted to bring up is oftentimes when people do come in from the medical field, they may not want to be using their medical insurance because they don't want any tracking system or paper trail, I should say, that they are in therapy. And so, so then that if that's the case, then obviously there's more of an expense to therapy. And I don't know if I already mentioned reducing stigma for mental health care. Identifying mental health training. So attending trainings, looking at the screening tools that exist for each one of us to gauge whether we're depressed or anxious or we need some help. And also looking at resources for healthcare workers, updating the type of information that's going to be admissible to malpractice liability, since that's a drawback for some to seek therapy, and also to remove barriers to care. I think, Sipan, that's it.
Yeah. So addressing mental health issues in healthcare providers. We have to really work on encouraging open discussions about mental health struggles as opposed to, stigmatizing. And of course, working on implementation of comprehensive suicide prevention and mental health promotion plans. It's also really important that we support and advocate for wellness programs for healthcare workers. Next up, we're going to talk about some screening instruments. So we have the PHQ-9. Our tool for assessing depression is not just a questionnaire, it's a gateway to understanding and treating depression, right? So the PHQ-9, and we'll specifically see the questions on the next slide, it consists of 9 pointed questions, each on a scale from 0 to 3. So there's 4 options. This instrument aligns with the DSM-5 criteria for major depressive disorder, ensuring clinical relevance. It was developed by Pfizer. It stands out for its accessibility and efficiency. It could be self-administered, making it a quick preliminary tool for identifying depression, which is crucial for early intervention and informed treatment planning. So the really good thing is that its reliability and validity are well documented, right? So there are plenty of studies confirming its effectiveness as a screening tool. It's instrumental in diagnosing depression, tailoring treatment plans, and monitoring therapeutic processes. So a lot of therapists frequently use the PHQ-9 throughout treatment to kind of see where the client's at. By leveraging such tools, we can make strides in mental health care, offering hope and direction for those in need. I actually would like to talk about a personal story. So I actually tried out the PHQ-9 on myself not too long ago. it was kind of a wake-up call, seeing those symptoms of depression right there on paper. But knowing is half the battle, right? Therapists, we call that insight. Recognizing this early, I implemented some self-care measures that successfully averted a downturn in my mental health. So this little self-test, it's a solid nudge to take care of ourselves too, not just patients. So here we have the self-assessment for PHQ-9. So this is the full PHQ-9. Again, we have the questions on the left side. This has to do over the last 2 weeks, right? So that's an important specifier. So there's not at all several days in the last 2 weeks, more than half of the days in the last 2 weeks, and nearly every day. So a lot of these questions have to do with your subjective perception of certain things. So number one, like little interest or pleasure in doing things, feeling down and depressed, those are more subjective. And then we have some more medical, more physical symptomology. So poor appetite or overeating, feeling tired or having little energy, things like difficulty sleeping. So maybe consider kind of mentally taking note of where you score on the PHQ-9 during maybe the last 2 weeks or a really stressful time in your life. So you add up all the columns, and then at the end, you add up the column totals, and your total score is either at 0, it's a range from 0 to 27. So if you're at about 5 or higher, or maybe 10 or higher, it's maybe time that you consider seeking help.
And great. And then this next assessment that we wanted to share with you is the GAD-7, and this assesses anxiety. So it's the evaluation of anxiety disorders used to really screen generalized anxiety disorder, GAD. It has 7 questions with each rated on a scale from 0 to 3. And it has demonstrated efficacy in measuring GAD. And it can also measure co-occurring anxiety disorders, including panic disorder, social anxiety disorder, and PTSD. I find a lot of Armenians come in with panic disorder, by the way, so it can help detect that as well. Valid and practical, it's a valid and practical tool, so it's widely respected for its validity and reliability in both the clinical and research context. It's concise, and it's a useful tool for routine screenings and ongoing monitoring. And this tool was developed by Spitzer and colleagues. So what I'm going to suggest, if you guys have a pen and paper next to you, I just want you guys to do a quick assessment on yourselves. I know you probably are familiar with this assessment already, and you perhaps have your patients complete this, but just go along with this for a moment. It'll be quick. Over the last 2 weeks, and just as Sipan mentioned, it's important to specify the last 2 weeks only. How often have you been bothered by the following problems? So 1, feeling nervous, anxious, or on edge. 0 for not at all. 1 for several days. 2 for more than half the days. 3 for nearly every day. So go ahead and circle the one that where you score. 2, not being able to stop or control worrying. Again, 0, 1, 2, or 3. Worrying too much about different things. Go ahead and rate that. Trouble relaxing. 0, 1, 2, or 3. Being so restless that it is hard to sit still. 0, 1, 2, or 3. Becoming easily annoyed or irritable. And feeling afraid as if something awful might happen. Now go ahead and calculate your score and have your total score. You probably just place some numbers and added that. And this last question is also important for the self-assessment. If you checked any problems, how difficult have they made it for you to do your work, take care of things at home, or get along with other people? What we look at in the mental health field is, do these stressors, do these symptoms impact your work, your relationship, your home life? Is it impacting your life somehow, right? Okay, so now drum roll, we're going to take a look at what your results are. As you can see, if it's 5 and above, you have mild anxiety between 5 and 9, moderate anxiety 10 to 14, severe anxiety 15 to 21. So typically, I would think it's nice to get some support, 8, 9, 10 and up would be a good time to really check in with someone. again, you can actually work with therapists without having any anxiety or depression or any main issues, just to have someone in there who you can talk to about different things. But this, again, is a tool that is quick and can just take a quick assessment of where you're at around anxiety. Okay, and then we're not going to go through each one of these items, but I just wanted to share that there are also assessments for domestic violence. I know when I was working at Kaiser Permanente with Dr. Evelyn Bogdasarian, we served on a committee together to help out patients who may have been suffering with domestic violence or as a battered person. But this is now as it relates to you as an individual. How do you assess whether you're in a relationship that is dangerous to you and or not, or that's harmful to you or toxic to you? So these are some assessments that may kind of allow you to gauge, where am I at, what's going on. Psychological maltreatment toward women scale. It's the HITS scale: hurt, insult, threaten, and scream. Women's experiences with battering. And the next set of slides, I just wanted to share about alcohol and substance abuse as well. And here, this is like where we start hearing someone say, oh, I just have a few glasses of wine a night with my dinner, or I only drink on the weekends, but when they're drinking, they're probably drinking a lot of tequila or vodka or ori, and so we want to kind of look into some of those statements sometimes, like, am I justifying my drinking? Am I minimizing my drinking or use? And I know in the medical professional field, there's a lot of access to medication, including opioids, pharmacists as well. So again, come back to, how do you gauge your use and whether it's impacting your mood or your work? And there are plenty of assessments that will help you get to this place where you can even ask professionals, therapists to do assessments with you.
All right. So here we have a suite of screening tools, but let's focus on the most popular pair, DAST and Audit. DAST checks for drug use issues, including everything from prescriptions to street drugs, while Audit zeroes in on alcohol and when drinking becomes a health hazard. Most of the time, they're used as a pair. They could give us a clear picture of a person's substance use, guiding us to the right intervention sooner. They're crucial in our assessment, especially for those in denial. By leveraging DAST and Audit, we're setting the stage for better, more informed conversations about substance use and health. Remember, these aren't just forms to fill out. They're the first step to getting patients, clients, and ourselves the help they need.
And then we have anger assessments. I think you guys all know I specialize in anger management, so does Sipan. So the most formal assessment, and you can do it as a self-assessment, is a STAXI-2, which is the state trait anger expression inventory developed by Dr. Charles Spielberger. That's probably the one that is reviewed the most for anger management, but there are other assessments that I included on this slide. But more importantly, these are some questions you can ask yourself. Can I regulate myself when I'm triggered? So when you're frustrated, are you able to regulate yourself? Meaning when you're speaking back, there's no tone, there's no lashing. Do you know what your style of communication is? Is it aggressive? Is it passive aggressive? Is it passive, or is it assertive? Do you have a tone that others pick up on when you're speaking and you're frustrated? Or do others report that you come off as aggressive when you think you're actually being assertive? And then there's obviously the potential of chronic anger on a daily basis throughout the day. This is something that it's the lens you look at the world with, of everyone's against you and people are doing everything wrong.
All right, now we're going to talk about self-care. So, some strategies on implementation of self-care, right? Challenge your thoughts. Therapists, I believe, call this cognitive distortions. So challenge some of those unhelpful automatic negative thoughts. So things like, I can handle this on my own, or I'll tell my partner and work it out from there. Explore some of the reasons as to why you're not seeking mental health services. really confront some of your thoughts regarding the stigma you hold regarding mental health services. Encourage one another to seek professional support. Reach out to that one person by next week and share about your struggle that you've encountered recently. Talk to your EAP if you're in a hospital setting, and assess yourself by taking things like the PHQ-9 for depression and the GAD-7 for anxiety. Next up, we're going to talk about some self-care strategies. All right, so let's dive into some effective strategies for immediate stress relief and better sleep. Starting with the physiological sigh, a breathing method promoted by Dr. Andrew Huberman. So you take a double breath in through the nose and then a long breath out through the mouth. So I'm going to demonstrate it quickly. When you fill up, you feel like your lungs are completely filled up. Go ahead and sneak in that extra breath all the way at the top. So it's going to sound like this simple action can help lower stress on the spot by reducing carbon dioxide levels in your blood. I actually do this before every single job interview. I did this before the job interview with Anita, and I got the job, so probably works. Next up, we have mindfulness apps like Headspace and Calm. They're like having a meditation guru in your pocket. They're easy to use and can make a noticeable difference in your daily stress with short 10-minute sessions, right? So already we have two options. One is 10 seconds and one's 10 minutes. And moving on to sleep, don't underestimate the power of good sleep hygiene specifically. Dr. Matthew Walker, a renowned sleep psychologist from UC Berkeley, brought to light the striking World Health Organization statistic. The WHO considers less than 8 hours of sleep daily to be a carcinogen, just like poor diet or not exercising. So try to block out disruptions with earplugs and eye masks and steer clear of blue light from screens before bed to encourage natural sleep rhythms. Okay. These tools are straightforward but powerful, helping to combat stress and improve your overall health.
Sipan, I feel like this is so challenging to do these days with our phones.
Yeah.
I wanted to bring this back to our the original three cases I shared with Eric's recovery. So Eric was the anesthesiologist who was angry at his workplace. He was actually required to complete an anger management program. And during the course of treatment, he learned why his behavior was not acceptable at the workplace. Now, typically this takes about 3 or 4 sessions at least before someone realizes what others mean by that they're aggressive or it's not acceptable. Most people have this image that in order to be an angry person, they're breaking things and yelling and destroying the room, and that's not the case. So he learned to shift his expectations and consider the desired outcome for his workplace. And having realized his actions were damaging to his colleagues and staff, Eric was able to implement effective communication skills with clear expectations and to express concern when necessary. And he continued doing his work from there on with the hospital. Now, Nicole's situation was a little bit different. There was a lot of trauma from her. I think it was a few months before she had even sought for services, but she came through EAP and then continued in therapy. And it was really to help her work through her trauma a few months after the incident. She eventually left the medical field, not wanting to take on the responsibility and risk any parent from losing a child under her care. So she searched for a while to see what type of work she could do with a medical background without actually practicing medicine. And she eventually found something and eventually left the career. So we see this happening a lot, which is why we stress the importance of don't burn out, get care right away. Typically, the employee assistance programs are designed to respond pretty quickly as soon as they hear of these situations as well, especially when the management share that. And lastly, Mark's recovery. He was the educational nurse who had to go to administer the the vaccine for the COVID. So he actually used over 1 year of PTO trying to avoid returning to work. But eventually, after therapy, he felt more comfortable returning to work and everything was okay thereafter. But that was a very stressful time for him. And of course, again, during the pandemic, that was difficult for many. So with all this said, with what Sipan and I have shared today, what is your mental health care plan? So knowing all of this, what is your next step? Are you going to start engaging yourself with some of these self-assessments from time to time, especially when you realize perhaps you're sleeping in more, your appetite's changing, things are bothering you more? Just go through some of those assessments. They're online. And if not, what's getting in your way? What will help motivate you to seek such support? And this is our contact information for both Sipan and I. And I just want to thank you for taking the time to hearing our talk today. And Hasmik, I don't know if she has to come back or not.